Hi there, this is Dr. Talari. Today, one of my students was asking me about how to prepare for the AMC clinical. She wanted to sit the exam in September and she was asking me, the study plan. When I started preparing for my AMC clinical, I had no idea. I did not have a plan. Many people think the AMC clinical is a tough exam. Yes, it's a tough exam. But if you prepare properly, it's a very easy exam. It's a tricky exam. There are lots of tips and tricks you need to know. If you don't know these tips, then most likely you will fail the exam. So I had a secret strategy, and I used the same strategy to pass all my 16 stations. I thought I'll do a short video to help you guys on how you need to prepare for the AMC clinical. The first thing many students ask me during my webinars and workshops is they will say, how much time do I need for preparation for my AMC clinical exam? Honestly speaking, there is no time. It depends on how well you prepare, how much effort you put into. But if you ask me, my sincere advice would be minimum of 3 months, because you need to do a lot of role plays. It's all about how you deal with that particular case. Most of the cases, it's got nothing to do with knowledge. Yes, you need to have a bit of knowledge, but knowledge is not everything. When I passed all 16 stations, I was not a genius. I was a very ordinary student, but I had some strategies which, if you follow, you will have no problem. The slide on the computer says divide and study. This is one of the strategy I used when I was preparing for my clinical, and that was the reason I was very successful in my exam. Okay, so you know that there are 16 stations, and you know that there are 3 from pediatrics, 3 from gynecology obstetrics, probably 2 from psychiatry, and maybe 1 or 2 from emergency. So if you add all of them, it's 3 plus 3 6 plus 2 8 plus 2 10. So out of 16, you have 10 stations, and rest of the 6 will be medicine and surgery. Okay, so this is how I prepared. I started reading the pediatrics first, because if you look at pediatrics, the number of scenarios they can frame from pediatrics are very limited. In contrast to medicine and surgery, it's a very vast subject. You have to cover a lot of things. So what I did is I tried to prepare pediatrics thoroughly. Because there are very limited cases. There are not many cases. There will be a child with fever, child with cough, a limping child, probably ADHD. There are very few cases. If you can master those few cases, you have passed the 3 pediatric stations. The same applies to gynecology obstetrics as well. These are not vast like medicine and surgery. There are very limited cases. So my sincere advice would be finish off these 3, finish off 3 pediatrics, finish off 3 gynecology obstetrics. Psychiatry is the same. There are very limited cases. If you prepare properly, you can finish psychiatry in maybe 1 or 2 days. And again, you need to have some strategies. All I'm saying is about the knowledge side of things. Then emergency. There are very few emergency cases which will be asked in the OSCE or clinical exam. So if you can prepare these properly, you can probably pass the exam just by passing these 10 stations. This was the same approach and attitude I had when I was preparing for my clinical exam. All I did was divided the cases, 3 pediatrics, 3 gynae obs, 2 psychiatry, 2 emergency. And I finished all these cases probably in 15 to 20 days. Or maybe a bit more. I had plenty of time. Believe me, I had more than a year to prepare for my clinical. At that time, there was a lot of waiting when I was appearing for my clinical exam. But nowadays, I was told it's very fast to get the AMC clinical date. So I prepared for 12 months. But I have to be honest with you. The time I spent on pediatrics, gynecology, obstetrics, emergency, and psychiatry was less than a month. Okay, so what I did was I prepared this, I was doing role plays, I read the AMC clinical book, then I went on to medicine and surgery, which is an ocean. Medicine and surgery can can take 1 to 2 months time just for reading medicine, which is general practice. General practice scenarios like approach to abdominal pain, chest pain, because abdominal pain itself can take 2 to 3 days. Chest pain alone can take 2 to 3 days. I've left those topics to the end because I wanted to pass the exam. To pass the exam, all I need to pass is 12 stations out of 16. So this was my mindset, and this is how I prepared, and this is the study plan, and this is the secret of my success. Divide and study. Don't waste your time on the ocean like medicine and surgery, because surgery again is a bit limited. They can't ask too many cases on surgery. So concentrate on this smaller task where there are less topics to prepare and smash these topics. Then go for the general practice where you can be asked anything from diarrhea, dizziness, abdominal pain. There are tons of topics if you just go through John Murtha. So this is the strategy I used. I hope this strategy will help, and I hope most of you will be benefited from this video. And this is the same strategy I teach my students in my workshops and webinars. So make sure you use the time properly. Plan your preparation properly, because it's very important. Many people ignore this. Just read John Murtha from cover to cover. Try to start with abdominal pain and finish with some chronic cases at the end. And at the end of the day, they will not finish the book, and they will not have a grip on all the topics. When they go to clinical exam, they fail. So my sincere advice is follow this. As I said, this is a talking exam. You need to talk a lot. It's not where you sit down and read and go and pass the exam. In this, you have to actually talk. So practice, do role plays with your friends. And I've started a clinical group, in Facebook. So if you can join there, I was thinking to do some videos whenever I have some free time. Like today I have a bit of free time, so I'm doing this video to help you guys. So if you just go to Facebook and search 2015 AMC Clinical Study Group, you will get this cover page, and join the group. Whenever I have a time, I will be posting some videos so that you all will be benefited, and hopefully everyone will pass the exam. It's a very tricky exam, but if you know the strategies, you can smash the exam. And again, believe me, anyone can pass this exam. Believe in yourself that you will pass, and you will pass. I wish you all the best.